So we're going to discuss sedative medication, antidepressants, anti-anxiety, and antipsychotic medication in this PowerPoint. So definitions: psychiatric drugs are any medication used to treat mental illness. Psychotropic is just another name for that. And the biomedical model is the idea or the theory that mental disorders are caused by abnormal biochemical processes in the brain. So it is actually a chemical imbalance. So the first type of, we're going to talk about antipsychotics to start. There are three types. The first one is first generation. So everything from a low potency to a very high potency, so very strong medication. There has been approved, some of these medications have been approved in children to manage aggressive and agitated behavior. But there's big caution not to use it when you're pregnant. So the second generation or atypical antipsychotics, these include things like Chlorozil, Zyprexa, Seroquel, Risperidol. There's really been no studies done on the safety for use with children. Some of these medications can be used for bipolar as well. Other uses for some of these medications, so behavioral problems, irritability, aggression, explosive behavior, ODD, OCD, and CD, conduct disorder, and sometimes OCD. These are the types of behaviors you'll see these medications used for, mostly for children. Again, not to use it during pregnancy. The third type, so for example, our third generation example is Abilify. This has not been approved with children, but it has been used. It's used for children with, for diagnosis of schizoaffective disorder, which again is a very rare diagnosis in children, but also for aggressive behavior and conduct disorder and ODD. Again, I'm not sure about pregnancy, but there are some studies that show bad effects in animals. So to decide on what kind of treatment, we're looking at the child's safety, of course, as the most important. And usually if there's a psychosis going on, a hospitalization would be important. And medication should be used at the very first sign of psychosis. The quicker you start an antipsychotic medication for somebody with psychosis, the less likely the psychotic symptoms will continue. Especially early intervention is important because psychosis can increase the risk for suicide. And the longer the person who is presenting with psychotic symptoms, the more difficult it is to treat. So medications are usually started at a low dose at bedtime, and they're gradually increased until they find a good dose when the psychotic symptoms get better, or until there's too many side effects, and you have to lower the dose. But if it's not tolerable, of course, you try a different medication altogether. So medication should continue for at least 1 year after a psychotic episode, except for people diagnosed with schizophrenia, because that will always need medication. But there is a difference between a psychotic episode and a full diagnosis of schizophrenia. So some side effects of these medications, something called EPS. It's blocking too much dopamine, so it kind of looks like Parkinson's disease, the same kind of symptoms. There's also something called neuroleptic malignant syndrome. It's a really bad EPS and can be fatal, so have to watch for these kind of symptoms. Other side effects, so it's blocking the acetylcholine receptors, which affects the parasympathetic nervous system, so things like dry mouth and eyes, blurred vision, etc. And then there's blocking different kinds of receptors, so leading to hypotension. So when somebody stands up, they kind of get dizzy and they have a low blood pressure, so they could fall potentially. Other side effects, tardive dyskinesia, so it's an involuntary movement, so it looks like kind of a tic, and this can take a long time to see these, but they can be decreased once the medication stopped. And there's always metabolic, or not always, but usually metabolic symptoms, so unfortunately weight gain can happen, and diabetes as well. So relapse prevention. So once the acute psychosis is treated and the child's condition is stabilized, so there's no active psychotic symptoms, the medication dose can be gradually decreased, but it should be over at least 12 months. But again, somebody who's diagnosed with schizophrenia, the medication will likely have to always be there. But if symptoms return for somebody who has a psychotic episode, you'd have to restart the meds. So depression. So need to address depression early and in a youth because the younger someone is, the more likely they'll have a recurrence later in life. So treating it early is important. But the DSM, there's a newer version, DSM-5, but the symptoms for depression does not really truly discuss the symptoms and how depression looks like in children, so it's a little different. So antidepressant medications are the first type is tricyclics, so there are significant side effects, unfortunately, and it's not really used in children. Other antidepressant medications, they're classified by the neurotransmitter they target, but the best outcomes is medication with therapy. So SSRIs, so selective serotonin reuptake inhibitors, some examples and their common side effects. Prozac is the only medication for depression that's approved for children ages 8 and up. There are other medications that are used, but there's no studies really showing their effectiveness. So when other medications are used to treat depression in children, this is called an off-label use because the label does not clearly say that they can be used for children. Serotonin syndrome is when there's too much serotonin in the system and it can actually be life-threatening. So it usually happens when you combine two medications that affect serotonin, and there are some symptoms that you'd have to look for if somebody is on two of those medications. So some treatments, medication can be used, fluids, so flush out the serotonin in the system, and withdrawal medication causing the syndrome. So have to stop the meds that's causing that. So SNRI, so serotonin and norepinephrine reuptake inhibitors. There's some examples and some potential side effects of those. Norepinephrine reuptake inhibitors, again, Strattera, and side effects is generally sedation. Norepinephrine and dopamine reuptake inhibitors, so Wellbutrin is one, and it has activation, so it's a kind of a stimulating effect on the person, and nausea could happen. So some atypical antidepressants, so Remeron and Trazodone. Trazodone is usually used as medication for insomnia, so help to sleep. Again, so they kind of use the side effects of the Trazodone to cause sleep, so sedation. So some over-the-counter medications that have been thought to help with depression, but there have been no studies on children, and you have to be very careful with some of these medications, especially anything that's a naturopathic medication, because there's really been no studies completed on these, and you never know what the potency is of those medications. And taking those medications can adversely interact with birth control pills. So if you're taking both at the same time, the birth control pill might not be effective. So some guidelines for antidepressant medication usually start at a very low dose and gradually increase to the point it's tolerated. So you have to be very careful when you're increasing a medication dose. Usually have to wait about 1 month to 6 weeks before increasing if there are no signs of symptom improvement. So if there's no real signs of the depression getting better, then you'd have to wait at least 6 weeks before increasing the dose, because it takes about that long to begin working. And it's always better to increase the dose than change to a different med to see if just a little more would help than change into a complete new one. So side effects can occur within the first few hours, but there are other medications that can help with that in the beginning. We have to be careful with a antidepressant because if the person actually has a diagnosis of bipolar, but it's not known because they've never had a manic episode, the antidepressant can actually cause a manic episode to occur. So you got to be careful. Some late onset side effects, so things that can take a while, so apathy or emotional blunting, so kind of people describe it as feeling numb sometimes, and emotional disinhibition, so their emotions they can't control and can't contain their emotions necessarily. So how long to continue an antidepressant? So usually keep it the same dose for at least 6 months after the symptoms have improved, and then you kind of taper off slowly, but there have been no studies on this for children. So when you're stopping a med, they can have withdrawal symptoms from this medication, so it is uncomfortable, so you have to go slow when you're decreasing a med. There can be increased suicidality if the med is stopped quickly. So they're not really sure if this is because the medication was either controlling the thoughts or if the withdrawal symptoms are causing some suicidal thinking. So the worst for those kind of symptoms are effects or Impaxil, so they really have to be slowed. And then these symptoms are rare with Prozac. So it should take about 2 months to discontinue any antidepressants, but always under the direction of a doctor. So relapse prevention. So most children who have one episode of depression will likely have another episode, but the medication should be discontinued very slowly, and always go back for more treatment if symptoms come back. So antidepressants and suicide. So an example of Paxil. So a study believed that it increased suicidal ideation, but there were actually no suicides. But there were suicidal gestures occurred when the medication was stopped. So again, we talked about that. But suicidality was loosely defined, so it wasn't really a very clear definition. In the UK, United Kingdom, it's banned all antidepressants for children except Prozac, because that is the one that has been studied for children. So some warnings about suicide and antidepressants. So why might an antidepressant contribute to suicidal ideation? So the thought is that it might be more activating, so it's actually giving some more energy, some more motivation, and some increased restlessness. Or it might be a dysphoric mania. So dysphoric meaning low mood, but you have the energy of a manic episode for somebody who actually has bipolar. So you're still low and sad, but you have a lot of energy, which can unfortunately lead to the energy to attempt suicide. Some non-compliance. So if they stop the med, then there could be withdrawal or loss of positive effects. So then the symptoms of depression would come back and potentially some suicidal thinking. Treatment can take several weeks before improvements can occur. So usually somebody who starts an antidepressant, people around them notice that there's an improvement for the person themselves. So that can make a person feel more depressed because they're not noticing any improvement, and they could feel worse about their situation. So anxiety. So affects about 5 to 18% of children. This is the most common psychiatric condition in children. So some medication, so SSRIs are the first choice to treat children, but always combined with therapy. Cognitive behavioral therapy is known to be helpful. Certain medications can be used for short-term specific phobias. Bipolar disorder, there's controversy about diagnosing children because they're a little young. It looks like other disorders as well sometimes, like the symptoms. There's more research that needs to be done. Some medication, so lithium has been approved to treat adolescents with bipolar disorder, and it is the first choice. Lithium is the first choice of medication for bipolar. You have to do blood tests constantly because the blood test toxicity is really close to the therapeutic dose, so you have to be very careful. Again, side effects, if you have too much, then it can be fatal. Anticonvulsants, so it's meant to be a seizure disorder medication, but it can also help with bipolar in mixed episodes. Has not been approved in children, and you need to do blood tests as well. A second-line medication for bipolar, but again, you need blood work. First line for adult bipolar, but there's some side effects you need to take into account, as with most medication. May need to combine some bipolar medication with other mood stabilizers to counteract the mood. Like I said, antidepressants can bring on manic episodes. You have to be very careful when starting a new med. And relapse prevention. So children relapse, unfortunately, and can take years to get to a remission, so completely symptom-free. Need early and adequate treatment to ensure compliance. So if they treat it well in the beginning, then it's more likely to have a remission, and needing long-term treatment. So looking at bipolar medication would be a continued, and antidepressant or antipsychotic could be short-term.